All right, well, I'm back in Dr. Fullerton's office about to get my assessment. Going to be interesting to see what he finds because I'm really not sure. Like on the drive up here or down here, I tried to think of like how am I going to present this because there's so much pain. I guess there's so many different things that kind of pain, but I can tell. After I've done this for so long, I can tell a lot of it is victims and not culprits. So I don't know, like, if he wants to know about all the victims, like if that will help hone in on what the culprit is, because everything is so connected. I feel like I might overwhelm him. So maybe try and focus on just the culprit, what I think is the culprit, but maybe, I'm not the doctor, so maybe I'll be misguiding him. So we'll see. All right, well, I haven't really had an opportunity to record the experiences from the assessment, what we learned until now, which now is when I'm waiting for Dr. Fullerton for my treatment. But to report in on what was found with the assessment, he found some issues with the first rib, and he's really like honed in, noticing, I guess now, the issues or the what doesn't look right with my neck muscles, like the sternomastocycloid, I'm forgetting SCJ, SCM, and the posterior scalene, the trap. Like he's noticing this is not right, and we think it's from the first rib not being in or from being damaged. Very odd with the back pain that I have on this side. He thinks that it is stemming from damage to my rib cage back here, and this kind of makes sense because the pain that I have is in my oblique, and he's checked out my oblique, and my oblique is fine, and I had pain here, and it turned out to be due to damage to my rib cage here. So maybe damage to my rib cage back here is causing pain here. So I'm not 100% convinced that treating my rib back there will help with my lower back pain, but it is consistent with everything else that we found. The damage being in my rib cage on my left side, and we've looked at the right side and haven't really found damage, like at least where I'm experiencing pain. So I'm going with it. I mean, it is damage, and maybe it's causing some kind of pain or other issues that will be resolved. If it's not, even if it doesn't treat the back pain that I'm specifically trying to fix, it will fix something else because it's damaged. And but I also have faith in Dr. Fullerton. Like, he's been able to discover all kinds of weird things, like you have pain in your right hip, that's due to damage in your lower left rib cage. So he's got a track record and proving himself. We'll probably do some, in the diagnosis section of today, we'll probably do some nerve blocking and stuff like that, and that will confirm, I guess, if the origin of the pain in my right side is due to damage on my left side. So should be interesting to see how it goes. I'll report in, maybe get a couple videos of him working on my trap, and who knows. Wish me luck.
Get some good twitches, huh?
Yeah. Sorry.
That's all right. You can't help the twitches.
Honestly, I'm worried I'm gonna twitch the needle, bend it.
What? spine.
All right, just saw Dr. Fullerton, and I apparently was kind of an exciting case for him because he's studying, learning, and going to be teaching about something called composite fascia. Apparently there's this one point in the body where the rhomboid, the lat, and maybe the trapezius dorsi, where all three of those muscles, they're separate and they move around independent of each other, but there's one point where they all connect, and that is what is called a composite fascia. It's the only place in the body, at least that I know of. Dr. Fullerton said that it's mentioned in literature in one book prior to this, so it's really not well known or anything like that. So he's kind of a pioneer with this, and he had a great test subject in me to take these ultrasounds and use them in his presentation to some other doctors. But the composite fascia in my left side was no bueno, and when he treated it, it made things on my left side a lot steadier. That's kind of the best way to put it. Like I did a lot of tests where, like, you know, resisting with my arm out, like I was strong up here, but it still wasn't very good at firing up. And once he numbed out the area where the composite fascia was, and suddenly everything was working. He also addressed lower some area with the ribs, and the serratus anterior, and when he numbed me out, I could then do a pistol squat on the side that I always have trouble with. So that was really strange sensation. Like, you're used to this thing being unsteady, and then you do it and it's steady. So that was pretty cool. So maybe after this, now I can do pistol squats on both sides equally. Also, he addressed a bunch of stuff in my neck, and like the scalenes, the sternomastocoid, SMC, and he also addressed a little bit of the sternoclavicular joint. But there's another muscle, kind of like the illiocostalis, but it's not. It's illio something else. And when he addressed that, oh my God, the referral pain! I was like, this is exactly what is wrong. So hopefully, all this will alleviate the issues I've had with overhead pressing. Hopefully all of this will alleviate the tightness and stuff that I experience here. The cracking will go away. The need to crack will go away. This ear feels a lot more open now. Like, it felt like kind of like I was in a airplane. You need to decompress, make your ear pop. It did that just on its own, and I feel a lot more comfortable. So we'll see what happens. I'll report in probably 2 weeks out and see how I'm doing. All right, Adam, signing off. All right, well, it's the morning after seeing Dr. Fullerton and getting my upper back and rib cage area addressed, and I just wanted to video, I guess, the band-aids, and see, to, like, for those visual people, just to see, like, exactly where the issues that were addressed. So this is obviously my back and band-aids, and this rib cage stuff, this all was, that line is more, I think, serratus anterior, and just different areas of the serratus anterior. We went all the way from the 12th to the 6th rib cage, I think. This one rando band-aid is, that is where the composite fascia is. That is where the lat, the rhomboid, and I think the SA, serratus anterior, all connect. And I'm really hoping that the damage was not so extensive that it required that it will require a second treatment or something like that. If you've been following my YouTube channels over the years, YouTube videos over the years, my serratus anterior has definitely been treated a couple times, all different areas, but it's a muscle that covers a large area of the rib cage. So we just keep finding more. He also addressed, they don't need, apparently these injections didn't need Band-Aids, but he did treat up here. I have a video of him, doing the numbing injections, but I think it's one of the spinal erectors that kind of runs here. He also did the middle scalene, posterior scalene, and I think addressed the sternomastoid clavicular joint or muscle. Also, he addressed the clavicular sterno joint. He's done it before. He said it didn't look bad, but it wasn't perfect either. So we had a little bit of extra PRP, so he treated that. I think the worst response I had, like the most severe response I had, was doing the spinal erector, which name escapes me, and I should remember that because it's much more informative than just saying that muscle that I don't really know. Anyway, but when he treated that, just shock pain went down my spine, cutting off around probably around the middle point, right around there, and just really felt significant. When he addressed everything, maybe even a little bit of the scapular levator. He might have just had to poke through the scapular levator to get to the other muscles. Anyway, feels severe, and really hoping that the desire to crack my neck has gone away, and I feel better and everything. So currently feel just a little stiff, a little worn out. Done it a lot of times, so I know what to expect. I'm currently in Austin in my hotel, and I'm gonna be driving up to Dallas in a minute or two, and it's not gonna be a problem. So yeah, just wanted to report in, just wanted to give the visual with where I got treated, and that's where the damage was, to go with the video of him treating my upper neck, or upper back. Anyway, Adam, signing off.